Welcome to YIMBYNation, a podcast exploring U.S. housing and the roadblocks to building more equitable neighborhoods. Join Jimmy, Peter, and V as they, and special guests, offer their unique perspectives on building more diverse communities and addressing the social problems that emanate from the lack of decent, safe, and affordable housing. Our hosts have served in the fields of advocacy and nonprofit, public, and private development, and are driven by their passion for community empowerment. Join the conversation and share your thoughts on social using hashtag YIMBYNation.
Welcome, YIMBY Nation, and thank you for joining us for our second season and second episode of 2024. Let's jump right into our conversation about how the access to quality housing intersects with quality of life, such as better health results. Today's guest is Gillian Pressman. Gillian has spent her entire career in the non-for-profit sector. She has been the leading fundraiser in programs for a variety of direct services and advocacy organizations, which focuses on ending urban inequality. Gillian is the managing director at YIMBY Action. Before she started YIMBY Action, Gillian was the senior director of development at the Peer Health Exchange, which is a national health equity organization. Gillian headed strategy and operations for the organization's national and local fundraising teams. She was also the executive director for Massachusetts at Generation Citizens, which is an organization that empowers young people to take political actions in their communities. Welcome, Gillian. Peter and I are very excited to have you here today.
Oh, I'm excited to be here as well.
Awesome. So to kick off our conversation, could you share with us, our audience, a bit more about your journey and what inspired you to be a voice in the fight against urban inequality and advocate for the YIMBY movement? And for those of our audience that are not, please tell us about what YIMBY Action is.
Yes. So YIMBY stands for Yes in My Backyard, and it is often in contrast to NIMBY, which is Not in My Backyard. And you may be familiar. If you're not familiar with YIMBY, you may be familiar with NIMBY. And the concept of this is that people like housing in theory. For example, homelessness. No one is in support of homelessness. No one thinks it's a good idea that people are living without housing. However, when it comes to, okay, we have a particular development project and we're building it in your neighborhood, you get people showing up to say, no, not in my backyard. We don't want this here. Those people are actually not representative. Most people, especially recently in recent surveys, really do want housing in their backyards. Most people are YIMBYs and not NIMBYs. But for a variety of reasons, the process really incentivizes the NIMBYs to come out and does not incentivize the YIMBYs to come out. So we're changing that. We want to be a voice of people who identify as YIMBYs, who think housing is great, who see all the benefits of housing, including benefits to our communities. If we have abundant housing, we have more walkable communities, we have more vibrant communities where there's more businesses, more art, more culture, more things to do, and also huge benefits to people, including people can, flourish. Things are affordable if you have more housing, and they actually can afford to live their lives, and all the way up to including health benefits, which I know we're going to talk about in this episode. So YIMBY Action is a national organization that really organizes people across the country to be those YIMBYs and get out publicly and advocate for housing and advocate for policies that will increase housing. And so I got into this because I was in other sort of social areas. You read my bio. So before that, right before YIMBY, I was working at Peer Health Exchange, where it was a health equity organization. And we tried to empower young people to have skills in navigating health situations. And then before that, I was in civics education, and then I was in after school and summer education. I was all in that space. And as I was doing that work, it kind of felt clear to me that really the root cause of a lot of the inequality that I was seeing in schools and in neighborhoods is due to housing. It's really hard to educate a young person if that young person is not housed and doesn't have stable housing. It's really hard to talk to a young person about health and, making healthier choices and accessing health resources if there are no healthy choices and there are no healthy resources in their community. So I really kind of got interested in neighborhoods and what makes a neighborhood vibrant and healthy. And that led me directly to housing. And so I was living in San Francisco, which is the epicenter of the housing crisis. It is really, really, really bad in San Francisco. There's really appalling levels of homelessness. And so I just started, kind of volunteering with the YIMBY movement. And then I ultimately was able to, become staff and go from there. And that was 5 years ago. So it's been a ride.
That's incredible. You mentioned something that is extremely important, right? No one wants to see homelessness, right? Because on one side, it's in their way. But depending on what type of homelessness it is and where it's going, the NIMBYs come out, right? So we don't want to see homelessness, but we don't want that type of homelessness in our community. I see that from your bio. You have your whole life so dedicated to serving the inequality that is being served or unserved justly. So I think that I like that about you and what you've accomplished so far. The one thing that stood out when learning about your work is also your personal experience with poor housing conditions and how that impacted your health. You shared a story about your stomach issues years ago due to mold sickness because of the type of housing that you could afford on the salary that you were at that time. And you've said that no one should have to have their health destroyed because they can afford to live near their work. Tell us about that experience.
Yeah. So I graduated college and I had a very low paying job in nonprofit. And, that said, I still had a job. It was low paying, but it wasn't that low paying. It was a struggle, but, I still, and I went to college and, so I had a lot of privilege and still, I was working in Boston. And so I wanted to live in Cambridge. And I wanted to live in, an area that had a lot going on, that was really accessible. I could get to work really easily. The place I lived was right near a train stop. So that was wonderful. And to do that, to be able to live there, I just really lowered my expectations about what kind of place I was going to live in. So I lived in a very, very, very small room in a 3-bedroom apartment, had a couple roommates. And the building was very old and I didn't really notice it right away. But then every once in a while, you would just see these like dark wet spots on the walls and you're like, okay, I think that's not good. And then years later, I had some stomach issues. And I just had a bunch of issues and I, went to a doctor and they did a bunch of tests and they're kind of like, okay, yeah, you actually have mold sickness. And I got my current, this was years later. So I was living in San Francisco, got the current place tested for mold, no problems there. So I suspect that it was that place in Cambridge. And so, so that sucked and took medication and, it was fine. It ended up being fine. But it's definitely the kind of thing where like, I think the lesson in that is that, people will do what they need to do to live near opportunity, to live near where there are jobs and near where there are things going on. And that might mean downsizing. That might mean overcrowding, which is also bad for health. It might mean what I did, which is just taking like a really crappy place that wasn't a good building. But people will do what they need to do. And what that means is that, it's not just about building housing. We need to build housing in areas where there are opportunities. So these job-rich areas, these transit-rich areas, we need to make sure that there's abundant housing because people need to be there and they will do whatever it takes to be there. So I think that was kind of the lesson. It's also interesting, and we could talk more about this, but, Cambridge, there was a study I read about like the healthiest cities in the country. And, and they're by measures of like smoking rates and obesity and access to healthcare and, all that. And Cambridge is actually number 4 on the list. The top 3 cities are all in all in California. I think it's like Berkeley, San Francisco, and Irvine, California. Also very expensive places to live. And it kind of shows that, there are areas where it's really, really beneficial to be in those areas, not just for the jobs and not just for the culture, but also for the health. Like, it is beneficial for people to be in areas where the smoking rates are lower and the obesity rates are lower and people are outside and walking and exercising and going to the doctor. And we are currently making it really hard to live in those areas because we're not building enough housing in those areas. And so if we care about health, that needs to change.
I agree.
Gillian, speaking of your time at YIMBY Action, your organization's work focuses on legalizing housing and removing barriers to affordable housing. Obviously a difficult thing to do in places like Cambridge and San Francisco and the very high income communities. But how do you navigate the often contentious debates surrounding housing development in communities? And what recommendations does your organization have to collectively fight against NIMBYism?
So housing is definitely contentious. And it's kind of what I talked about earlier, where, people like housing in theory, but there is a very organized, very motivated group of people that often comes out when it comes to housing in their community. Will come the NIMBYs, and they'll come out and against that. What we really believe about that is we're not going to convince those people, the people who are really motivated to turn out and to say, oh, no, absolutely not. You cannot build this in my neighborhood because it's going to ruin my view, or it's going to, take my parking spot, or, whatever it is that people are afraid of. Often it's just like fear of change and fear of new people and, fear of not liking construction, which, is reasonable. Construction sucks. But, whatever it is, those people are not going to change their minds. And so what we can do, and what YIMBY focuses on doing, is getting people who are not showing up to start showing up. So for every person who is showing up to a housing project hearing and saying, no, not in my backyard, studies show there's at least, 5 to 7 other people who are sitting at home saying, cool, housing, that sounds like a good idea. But, they don't have the drive. They're not incentivized. There's nothing, really driving them to show up. And so we need to change that. We need to organize those people, get them to show up, get them to be the voices of like, yes, this is actually good. That said, the other piece of it is that when the process is really that local, when you decide stuff at the hyper local level, it's going to be really hard not to default to NIMBYism. Because that's just, human nature. It'd be the kind of thing where, like, if you voted on it, and I don't think housing is a tax, so this is not an example, but, if you voted on a tax, and if everyone was like, oh, we want to increase a tax so that we can, fund a new hospital or whatever it is, and that's a citywide vote, and, that's fine. The decision is made. But then if you went to people and you said, hey, I'm about to charge you, $10 for this tax. Do you still want it? Like, everyone would say no. Everyone would be like, no, I don't want it. Because that hyper local level, like when you get to the actual, like where the rubber meets the road, people are thinking about their in the moment interests. They're thinking about their very, very narrow interests, and they're not triggered to think about society and good and some of their values. They're not really thinking about their values at that local level. So what we need to do at YIMBY is certainly we need to turn out different people. We need to turn out the YIMBYs to the hyperlocal housing project hearings, but we also need to take decision-making out of that level of government. The ideal is that you do community-wide planning processes, and, you have a whole, lots of hearings. We like community input. You have a whole process where you say, okay, these are the areas where we're going to build housing. This is how much we're going to build, et cetera. And then you build it, and then it just happens. And then, if somebody proposes a project that fits the plan, they get their permits, and that's it. And it just happens. And there's not this constant like remaking the decision. We even think that like state level is very important, because often localities are specifically set up to exclude people. A lot of these towns got organized with the idea of like, we want to live here and we don't want people to live near us that we don't like or that don't look like us. And so they are not incentivized to think about bringing new people in and think about inclusivity. And so statewide legislation is really important too, where a state will say, okay, this type of housing, has to be allowed everywhere, has to be allowed in these areas. And then the localities, can't unmake the decision that's made at that higher level of government. So those are the things that we try to do.
We've been impressed with your extensive history and development and cultivating relationships for the nonprofits that you've worked with that focus on advocacy and growth. Why do you think it's important to hone in on fundraising strategies to help advance and support the goals of YIMBY? And what other strategies have you found most effective in mobilizing communities to support policies and organizations that promote stable housing choices for all? I was struck by what you were just talking about and how, you often have very local contention around a development that's moving forward, and you have neighborhood opposition that shows up. It may be a minority, but they're the loudest voices, right? So how do you organize around this? I presume it's on a much broader basis than a project basis or a neighborhood basis. I presume it's on more of a citywide basis. And as you're talking now about statewide strategies as well, can you share a little more about that with us?
Yeah, so the way that we're organized is we have a chapter model, and it typically is a city-specific chapter. Sometimes we have chapters that cover a larger region. So, for example, we have YIMBYs of NOVA, YIMBYs of Northern Virginia, that covers a few different jurisdictions in the Northern Virginia region. But, either at the region or the city level, we have a chapter, and the chapter plugs into local opportunities. That does include specific housing projects. So we will try to identify, partner with developers to understand what housing projects are up. And if, the housing project, offers housing, especially if it offers housing in areas that have excluded housing, so especially those high opportunity affluent areas, we're really excited about housing there. We will, we'll show up and we'll try to be, that voice of yes at the hearing. So we do that, but we also work we'll work with, city council and planning commission on like local legislation, getting certain types of housing legalized, like accessory dwelling units. A lot of cities don't have that legalized. And that's, an easy way to add new housing. And there tends to be, if the laws are right, there tends to be pretty quick uptake on ADU laws. So we'll try to do that. We'll try to, get ADU laws passed and get, other types of housing passed at the local level. And then if we have a bunch of chapters in a state, like we do in California and Virginia and Colorado, we'll do some statewide legislative advocacy too. So we'll all work together and, bring in the state stuff. Every stuff has to be a coalition effort. So we'll bring in coalition partners. And we'll try to mount some, make relationships with state legislators and try to do some legislation. The other part of it is that YIMBY Action is a 501c4. So we also do endorsements, and we actually say you should vote for these specific candidates. And we find that that's really useful as a way to elevate who is good on housing and make those people more accountable to housing. If we can build relationships with candidates by getting their endorsement and also directing volunteers to support their campaigns, that really helps in having some sway with them when they get to office and they feel accountable to that pro-housing platform. So that's the type of stuff we did. It's organizing people to plug into projects and legislation and elections. And fundraising is important because moving people is hard. You can't just say like, okay, I'm going to put a Facebook ad out that says, hey, people who care about housing, start showing up to support housing and, try to get some housing laws passed in your community and make sure you elect pro-housing people. You can't just do that, so maybe that's a part of the strategy. Maybe people will get excited about that, but it actually takes facilitating, a lot of gathering people together, a lot of getting people in the right room, giving them the right tools. They need to have an email list and grow their email list and, post those more targeted Facebook ads and be able to do that. They need to have meetings and know where they're meeting and, have the Zoom set up. And coaching too, a lot of folks come into this, they don't know anything about politics. They just want to see more housing in their communities. And so it takes coaching and training and, connecting them to other people to help them learn, okay, here's how I grow power and here's how I build political influence. And so that takes some active facilitation. It doesn't take a lot. I think YIMBY Action, we work with 60,000 activists across the country, and we have a team of 20 people. So, we don't need, it's not a lot. It's pretty high leverage. And when you have people that you need on staff to do all this stuff, it costs money, and we can't grow the teams, and we can't get, the talent that's needed for a mission that's as ambitious as ours. We can't recruit that talent unless we can pay people, a somewhat competitive. They're going to make less money than they would in a tech company or something, but we need to pay them a somewhat competitive wage, and we need to get good people, and we need to keep those people, and we need to be able to grow their team so that they have the right support. And that takes funding. So, what I always tell people is there's a lot of ways to participate. Certainly, if you can be a volunteer, if you can show up to the housing project hearing, if you can, canvass and door knock for a good pro-housing candidate, that's awesome. And/or donate, because your funding really matters, and it really goes not that much funding to retain a pretty small team, can really fuel an entire movement.
Yes, that's very impressive. I was impressed at the scale at which you've built the organizations you've been involved with your fundraising. I spent the first 10 years of my nonprofit experience running door-to-door canvas operations for a national nonprofit, and then ran housing organizations where, as the executive director, of course, you have to do that fundraising. So you've done a terrific job, obviously.
Thanks. I mean, I think I have lots of thoughts about fundraising. If anyone wants to talk to me about fundraising, they can. But I do think fundraising is, there's always more opportunity than you think, and there's always people in your network. There's always people in your network's network. There's always people that you can tap. People want to do it. Some people are scared of asking for money, but people want to help and they want to contribute. And honestly, clicking donate on your link is a lot easier than giving public comment. And so some people that's a way to plug in and make them feel like they're doing something that matters. And so, fundraising is really just making a list and asking that list, and then adding people to that list and asking them and following up. That's really that's all I do all day, really. I mean,
it's a relatively large organization with 60 employees. What percentage of your budget is small donors versus grants and foundation support and the like?
It's actually about 25%. So
that's pretty good.
We have a membership model, so people can do $5 a month to become a member, and that does sustain a decent chunk of it, which is good. So, and then we have a pretty diversified fundraising model beyond that. So yes, we do have foundations, we do have company support, we do have major givers, people who are giving us larger donations, and we also get money from different geographic regions. If we are doing work in a geographic region, we try to build up local fundraising so the local dollars are sustaining that work. It's we're definitely not the kind of organization that's we have one big funder and, we don't have to worry about fundraising, which I think makes us really stable, is a little exhausting, but also builds power. I definitely truly believe that people who give you money, that's why it's important to get some of the big philanthropy. Philanthropy is getting there, but I would like to see more big philanthropy take housing really seriously and see it as a really critical issue. When that happens, that'll be really huge for the movement in itself, not just because it allows resources to flow, but because it really means that this is a bread and butter issue that, the powers that be think is important. So I do see our diversified fundraising means that we have diversified support and diversified sources of power. So I think that's good.
Yeah. Institutional funding also means they're becoming invested in that issue.
Exactly. Yeah.
And the truth of the matter is, and as you mentioned, there's so many different avenues of reaching people. You mentioned the NIMBYism out loud and spoken. And you do need the boots on the ground. You do need the social advertising and those close resources to do it. So fundraising is such a critical aspect of being able to achieve your mission. And like Peter says, it's incredible how you've been able to structure that. So that's awesome.
Thanks.
With your educational background in pre-med studies and current advocacy work, how do you see the intersection between housing and health evolving? And what specific intervention do you believe are necessary to address the health disparity related to inadequate housing conditions?
Yeah, so I'll talk a little bit about housing and health in general. And then I can answer your question about where it's going, how it's evolving. So there's lots of research about this. So housing affordability is a really big deal. So people who spend a disproportionate amount of their income on housing, they have less to spend on, medical treatment. And so they often postpone it, or they'll rely on emergency room care instead, which is, very costly, and not always not always at the right moment. Emergency room is often last minute. They've done studies with children where in areas with lower home affordability, children suffer from more behavioral problems and lower school performance. So it affects children. What you often have also with housing is if you have really expensive housing, you're going to get overcrowding. So you're going to get, okay, I need, 6 roommates in a 2-bedroom, you just pack people in. I think we know about this from the COVID crisis, that overcrowding is bad. It lets things spread really quickly. And so that, that's not good for housing. Residential crowding has been connected with respiratory infections and psychological distress. It's not fun to be sleeping with all these other people. So people need safe, affordable homes if they want to have, good health outcomes. But I think the other piece, and I touched on this a little bit, is that those homes, they really need to be in areas of opportunity. If they're not, so if, you have, in San Francisco, you can get jobs because San Francisco has this, very vibrant, economy with all sorts of sectors and all sorts of service needs and, tons of things that you can do. It's very hard to live in San Francisco because it's very expensive. So what people do is they live very far away and they commute. And long commutes are really bad for your health. They're associated with increased stress, poor cardiovascular health. They result in how can you go to the gym if you spend, 4 hours a day in your car? So you're less physically active, you have greater risk for, diabetes and heart disease. You're more isolated. I think if you have a super commute, over 2 hours, you're twice as likely to get divorced, which isn't good for people's health. You're less likely to spend time with friends. You sleep less. You have, because you're exposed to more pollutants, you have higher stress levels. So commutes are bad. And then, you're also missing out, I talked about this a little bit with Cambridge, if you're not allowed to live in healthy communities, you're missing a huge opportunity. So if you're around people that don't smoke, you are less likely to smoke than if you're around people that do smoke. If you're around people who are not obese, you're much less likely to be obese. If you're around people who are physically active, you're much more likely to be physically active. It is really important. Culture is really important for health. And again, what we've done is not only have we made it that there is such a limited supply of safe, affordable housing, but we have especially made it that there is a limited supply of safe, affordable housing near jobs and in these very, very healthy places. And so that's bad. So the housing shortage is a real driver of health inequity. And I see, in terms of how it's evolving, I think this is being recognized more and more. There's, the term social determinants of health, where it's a recognition that it's not just okay, you need medicine. So we're going to, you have obesity and related problems for obesity. So, here's some medicine. It's much more about okay, there's systemic things that make it more likely that you have obesity. Housing is one of those. And, we need to address that. And so there's some great organizations that are thinking about the social determinants of health. And I think hospital systems, healthcare centers are thinking about that more, which is wonderful. Where I would like to see it evolve is a real emphasis on this high opportunity, healthy communities part of it. I think there's a little bit of okay, we have these far away, unhealthy communities, what can we do to make them healthier? And can we institute, policies that will make these communities healthier? And I think that's good. And we are systematically blocking people from living in the areas that are already healthy because we're refusing to build enough housing there, which is, real example of health inequity. And so I would love to see more of a focus of this. This is hard. I think people don't like to think about like, okay, my community, especially if you're like in circles, if you get to the point where you're in power and you're making decisions, or, even if you're a doctor, you're a doctor, you're an established doctor, maybe you're living in like, a nice area that, you have this big house and there's not that many people that live around you. It's very, very expensive to live in your community. That is exactly the type of community that needs an apartment building, that needs several apartment buildings, and that needs to allow people to come in. And often you don't think about that. You're kind of thinking about like, oh yeah, we need to fix these other communities. You're not thinking about, we need to make it easier for people to move here. So that's what I'd like to see. I think that's where it's going.
You mentioned something earlier that ties in with this. You said that when it comes time for voting, whether it's on new housing coming into a community, the NIMBYism, they come out in masses, but the YIMBYism, they stay in, whether it's because they're fearful of coming out, they just don't understand what's happening, and your team spend tremendous amount of time trying to outreach and educating. And that's all a part of it because, as you mentioned, that effect on people's health and relationship and is tremendous. So you answered actually pretty well. I actually didn't think about how it all connected, but it does. It does connect in a big way. And I've been able to get to work within a reasonable time, driving 2 hours each way, that's 4 hours. There's that time that you take away from whether it's going to the gym with the friends or family relationship. That all over time, over a long period of time, would affect anyone, and not in a great way for their health.
Gillian, during your time at YIMBY Action, what data have you seen that shows how life expectancy or health improves with better quality of housing opportunities? And as a follow-up, do you find any specific marginalized groups of people that are more impacted by inadequate housing opportunities and resulting health issues? For instance, the CDC reported a few years ago that the life expectancy of Black males was 67.6 years compared to white males of 74. That's a wide gap, and I wonder how housing security plays a role in combating that.
Yes, very big gap. In terms of the data, I can share some of the sort of the studies I just kind of mentioned, and the inverse of them is true. So if people have shorter commutes, then they are more likely to be physically active and less likely to be isolated and all of that. These are some of the reasons why housing affordability, especially in areas of opportunity, is good for your health. You're absolutely right that these disparities definitely fall along income lines. So lower income people are more likely to live in unsafe, unaffordable housing and experience those long commutes. And they also fall along racial lines, even when you control for income. So these health disparities, are very much, there's racial disparities in health. And part of that is, because of these housing disparities. I think like what's important for people to know is, thinking about why we got here. This is not unintentional. Why we got here is that in a lot of communities, there originally was white areas of town and Black areas of town. And in some instances, actual zoning laws that said you are only allowed to build housing for white people here. You're only allowed to build housing for Black people here. This was like really, really very explicit segregation. That was outlawed, where it was like, we can't have racially explicit zoning laws. And what replaced it was low density zoning laws. So, okay, we can't have this be the whites only area of town, but why don't we make it so that it has to be single family only? So you can only build a house, a detached house that fits one family. You can't build an apartment building that has multiple units. Because of all our other racism issues, Black people are less likely to be able to afford a single family home than an apartment, at this time. And so this will be our way, our sneaky way of keeping people out of our community. And it is even written. So I think, Berkeley, California had, which is again ironic because it is like the #1 healthiest city now, had the very first zoning law. And it said, it basically said like exactly that in the text, is this will be a great way to keep out the Negroids and Asiatics. Like it was like very, so they can't actually say this is whites only zoning, but it actually was, very explicitly in the impetus for creating that. And so that's what you have. You have these patterns in city after city after city where you just have completely low density zoning areas that are completely off limits for apartments. They were created for racist intent. And they still have racist impact. So it is still true that it is, because it is so expensive to live in those areas, and because people of color are disproportionately likely not to have, the money to be able to live in those areas, generational wealth or whatever, or income or whatever it is, you're going to have areas that are largely white. So that is still true. And, that contributes to, and again, those areas are also the healthiest. Those areas are where people have, they go to the doctor. Many of them are doctors, and, they don't smoke, and they, and they walk around, and they have access, they have gym memberships, and, they have really important, they have social and political capital. So if like something is unhealthy, they can like activate their connections to make it better in their community. And these are the areas that are still disproportionately white, and we're cutting people of color out of them. Even though the zoning law is no longer racially explicit, it is still racially implicit and has racial effects.
It's funny because our previous podcast, our guest was Yona Freeman, and he's very knowledgeable about zoning. He talked about Berkeley. He talked about the unintentional versus the intentional meaning behind the zoning. It was everything that you just described, right? Who you want to keep up, who you want to bring in. And even though over the years, the zoning laws are changing, there's still some manipulative aspect of it to continue the old tradition. Now, you have low bridges that were built centuries ago to keep buses from coming in. And those bridges are still there and still standing. But you're right. I think to that extent, how involved are you with the zoning departments, the building? Because I think this is such a big part of YIMBYNation. Because if you can pass the zoning to make the community be able to do affordable housing or housing in general, then how do you progress? So how does YIMBY Action deal with zoning?
Yeah, so that's our slogan. We have a slogan. We have it on a bunch of T-shirts and hats and other swag. We have a YIMBY store. You can buy it at our YIMBY store. And the slogan is legalize housing. And that's what we're talking about. Because zoning are laws that say you can only build certain types of housing. And it makes housing illegal, basically. And so we want to legalize housing. We want to change the zoning laws. So yeah, they're laws. It's a political, they're made politically. And so it has to be a political process. So typically what we do is, the elections, all the way back to the elections, that stuff matters. So we want to get people who believe in building more housing, believe in making it easier to build apartment buildings. Oftentimes, if we kind of get enough energy for these issues, we can kind of have it be a litmus test for candidates if they want to build in certain areas. So for example, San Francisco, the low density single family only areas is mostly are on the west side of the city. So we ask candidates, how do you feel about upzoning on the west side? How do you think about that? And we want them to say, yes, we should do it. And so, that's important to like find and elevate and really make a lot of noise for candidates who want to be bold on zoning. And then, for when people are in office, it's lobbying, it's getting people to show up and say, we want this change. Typically what happen is, you form a little coalition. So it'll be you and some other groups that have influence over an elected official. This is either the local or state level. And you'll work with elected officials to get some legislation sponsored. So for Atlanta, we're in Atlanta right now. And so we've been working for a while with a few city council members to sponsor an accessory dwelling unit ordinance. So that would change the zoning laws to make it legal to build accessory dwelling units on single family lots. And so we've been working with them for a while to like mount this legislation and, make sure the legislation is strong. And then the political process starts, so when the bill comes up for a hearing, we have to get people out, to tell their story and say why this matters. We have to get people calling their Congress people, or, in this case, their city council people or their state legislators. We have to get those voices out. People think that like this can happen in a room somewhere. You have a bunch of smart people in a room and you say like, hey, hey, legislator, have you seen the studies? Zoning reform is a good idea. You should do it. And they'll be like, yeah, the data, that's compelling. Like, you're right. We should do it. It doesn't work like that. Like, you have to make it the elected official feel like this is popular and that they will get reelected and they will get cheered on if they vote yes on zoning. And so that means getting people organized to make those calls and make a lot of noise. So, you can't really do this with like a person. It has to be people. It has to be lots of people. So that's kind of our strategy. And, it's worked. I mean, we've gotten, we started in the Bay Area in California, and we've definitely not enough. There's still a ton of work to do, but we've gotten some, really great zoning laws where it's actually legal to build housing in areas where it wasn't. We've gotten some stuff at the city level. We just had what's called missing middle, which is like small apartment buildings. We just had that legalized in a couple cities in Northern Virginia, which is an area that has been hard to build. So we're getting stuff done.
Awesome.
That's
awesome.
terrific. We've been doing this podcast for a few years now, and because we all share the same passion, I'd love to hear what you feel are the issues or stories that aren't being told that we should use our platforms for to shed more light and address in the housing space.
I mean, I guess I would just repeat what I've been saying in that, a real key to this is that we need to build housing in affluent areas. So we need to build housing in exactly those areas where we historically have not built housing. And we're not going to solve this crisis without it. Let's say, let's say there was like a really big building boom, 2 hours outside of New York. Like there was just tons and tons of housing and, we had all this housing and that was great. Like that's still good. The fact that we have more housing in at least like spitting distance of a major economic center, like, I'd rather that than nothing. Like that sounds good. But really like, it's really not addressing, the inequality that we're worried about. It's certainly not addressing like the health inequality that we're worried about, because those people are going to live there and they're going to commute into New York, or they're going to take less fruitful economic opportunities because they're not able to live, in the actual city, and right around the city. So like, we really need to address this. We need to think about the areas that have not built housing and like really upzone them. And, I think this is like, it means questioning what people think is like their ideal life in some ways. So a lot of people have this ideal of, when I make it, when I get to a certain level, I'm going to buy a house. And they're certainly not thinking they're buying, a place in an apartment building. They're thinking they're buying, a house with a lawn and a white picket fence, and they have their 2 dogs and their 2 kids and all that. And they're thinking that, and that's what they want. And it'll be, a quiet neighborhood, and they'll mostly be like people like me, and, and that will be my life. And what we're asking people to do is like really question that, because that's not going to get to societal equity if we try to like hold on to that lifestyle. And especially, what's most annoying is like, it's one thing if you want to like live in the middle of nowhere and have that lifestyle, like albeit, but especially if you demand to be able to have that lifestyle in an economic center, there's parts of cities that like are like that, and like there's parts of every city that like look like these like leafy suburban neighborhoods, and they're in the heart of the city, like near to all the opportunities. And the residents have demanded that their city just, that's a little part of the neighborhood just stays like that. And so we need to let that go. And instead, what we need to embrace is what I think is actually a better way to live, which is a little more vibrancy. So, maybe you live in a small house and, there's an accessory dwelling unit behind you. So you have, your friend lives right in your lot, or you live in an apartment building and, you have lots of people that, you have a nice view, you have a much better view because you're up higher and you can see better. And, you've all these neighbors that, are just right. Like, you don't even have to go outside to say hi to them, and you can walk to your coffee shop and you can walk to your gym and you can walk to the grocery store because everything's close and there's enough density to like really add stuff. And, and yeah, maybe it's not as quiet, but you hear children laughing and you hear, somebody like, strumming on a guitar. And it's just like, that is the type of lifestyle that we need to elevate and that the vision that we need to craft. But that does mean letting go of like what I think people think in America as like making it.
Where does affordability fit into the sort of matrix of goals that YIMBY Action works on? Is it really more location and density that is important in urban communities? I mean, if it's all market rate and, expensive urban areas, it's still not reachable to the majority of people. So where does affordability fit into the work that you do?
Yeah. So, sorry, I skipped over this because affordability is number one. It is absolutely number one. Why we do all of this stuff is because housing needs to be more affordable, and housing in high opportunities needs to be more affordable. You shouldn't have to choose between living in an urban center and living and like being able to afford your rent. Like that's, it needs to be affordable. So, and that's why we started, we started because we were like, wait, we're a bunch of us who like, in some cases, like we're college educated, we've like done well. We did everything we were supposed to do. And like, we're living in mold infected apartments, or we're living like we have to work 3 jobs. Like it is impossible to afford housing. So affordability is number one. And the reason we focus on supply is that, you have to have more, like supply is the key to affordability. Like you have to have more, supply and demand, like you have to have more housing. You have to address the housing shortage if we're ever going to get to affordability. You can sometimes sort of create these artificial affordabilities, like things like rent control. Fundamentally, we're not going to really truly get to affordability unless we build more housing. And the evidence shows that overwhelmingly. It shows areas that do build housing, the rents go down, and areas that continually build housing, areas around them that aren't building housing, their rents go up, and the areas that are continually building housing, their rents are staying the same or going down. Like this is how to keep housing costs low. And we actually do support market rate housing too, instead of just, so there's in the industry, like it's called affordable housing, but it doesn't mean just like affordable. It means like subsidized affordable housing, which means, it takes government subsidies to build, and it's income qualified. So you have to like you have to, be below a certain income level in order to like qualify to live in that housing. We absolutely support that housing. We need subsidized, deeply affordable housing. And we support market rate housing too, because market rate housing also, building tons of market rate housing also dramatically increases affordability. And if you don't build market rate housing, and if you just build subsidized affordable housing, and let's say your income qualification slide, or, like you'll get displacement. So people at the top of the market, they're going to come, they're going to keep coming, they have the money to come, and they're just going to take the lower income housing stock, and so if you really need, like it's, we talk about musical chairs a lot. Like it's kind of a version of musical chairs. Like if you keep taking chairs out, like no one's going to get enough housing. And the only people that are going to get housing are the richest people. So we need housing at absolutely all levels. We need abundant housing. We need all the housing that we can get. And that's the only way to get to affordability.
You talk about affordability and housing. We're not only my industry, we're construction managers, so we manage construction projects for housing agencies, and I've done over 300 units for New Haven Housing Authority, and I understand how that affordability works for housing entity. My company also, we have apartments, and one particular apartment unit that we have in one of the towns in Connecticut. It is an all market rate housing, the apartment building. However, we do have about 50% of the tenants have Section 8 vouchers that is being subsidized. So, and maybe 4 blocks away from that area is another housing where it's all Section 8. It's not a market rate housing. And you can see the difference. So I agree with you that you could have all market rate housing and still be able to blend affordability in it by working with your local housing agency and those that are working and making that 30% of income, being able to go toward the rent and also getting the subsidized income from housing. So they're able to be in a nice apartment. They're able to be close to their work environment because we are very close to downtown. So there are very many ways of presenting affordability to individuals that can better their life. The other thing I also mentioned is you mentioned about one of the things that people don't see or the things that we don't talk about. I think it's so important to be able to have a diversity in neighborhoods because you get to learn about different people. In our office here, we even go to the extent of, if you look behind me, we have the Ghana flag, we have the American flag, we have flags from Ecuador, we have flags from Italy, because we have such a diverse group of staff members that work for us. And the more we go out there, whether we're building for government agencies or housing, or we're building for ourselves, we see the diverse group of residents that are living in these different houses. The diversity is all about learning, and that learning just makes the community and the neighborhood better. So always for YIMBYNation and YIMBY Action.
Yeah, no, integration is a really key part of our vision. And again, these things are very explicitly not integrated, and we're trying to dismantle that. I grew up in a very integrated community. My school was actually Spanish was the majority language in my school, and white people were the minority. And it was wonderful. And, I think we I definitely learned a lot. I think there was we learned from each other. There's definitely had a lot more cultural sensitivity. When I went to college, I was like, why are there so many white people? This is weird. It was a wonderful experience. And I think that is increasingly rare. And it's true. We have gotten more and more and more segregated. Our communities have gotten more and more segregated. And then by virtue of that, our schools and our other institutions, because of housing, because we're just increasingly making it impossible to build housing in high opportunity areas. And so, only white people can live there. And that's bad. We should be fixing that.
But I think YIMBY Action is doing their part. I think if every individual would do their part, then eventually we'll get there. Slowly, but we'll get there.
Really.
Gillian, thank you so much for sharing your insights, passion, and expertise with YIMBYNation today. And as we wrap up this conversation, do you have any closing remarks, call to action, or final takeaways that you'd like to share with those that are listening or watching? And also tell us how we can get in contact with you.
Amazing. Yes. So everyone can take action. It can be anything from a click to share YIMBY endorsements with your network so they know who to vote for, who's going to be good on housing, to all the way up to, showing up for public comment and, getting your hands dirty. And of course, donating at any level matters and fuels the movement. So the best way to get plugged in is YIMBYAction.org/join. And you can sign on as a member. And that lets you get plugged right into, we have this really vibrant online Slack community. It has 5,000 people on it, super well organized, and a really wonderful resource if you want to connect to that. Or if you want to kind of get plugged into activism opportunities. Once you join as a member, YIMBYAction.org/join, you'll also get connected to your local chapter. So if you have a chapter in your area, which is, we probably do have a chapter in your area, you'll get on their list and you'll kind of see local action opportunities. And so you can plug in locally. So you don't have to find your local chapter necessarily. You can kind of plug in, on our main page. Or if we don't have a chapter in your area, you can start a chapter, but, start at YIMBYAction.org/join, and then we can take it from there. But yeah, and everyone can do something. This will take a movement of people. Everyone is needed for that movement at all levels. So, excited for some of you to get more involved.
Awesome. And Peter and I are very excited to have been able to have this discussion with you. Thank you so much for joining us for this episode of YIMBYNation, and stay tuned.
Yeah, we all learned a lot. I think I speak for all of us in saying we really respect the work that you all are doing. I think it's terrific work.
We sure do. Yeah, you've done a great job, Gillian. Thank you for all the things that you do.
Thank you so much.
Great. And this concludes our podcast.
thanks for joining us and listening to today's episode of YIMBY Nation. Continue the conversation in your communities and on social using hashtag YIMBYNation. Connect with V at www.vaseconstruction.com. Connect with Jimmy at www.sincereconsulting.com. And connect with Peter by searching Collaborative Development Consulting on LinkedIn.com. Please leave us a rating and review on your favorite podcast platform so we can continue helping communities thrive. Email us at contact@yimbynation.com or visit the podcast website at www.yimbynation.com. Until next time.